Hi, this is Jason Wasfy. I'm one of the medical directors of the Mass General Physicians Organization. I'm here today with John Marshall, Director of Clinical Pharmacy Services for Mass General. And we're just chatting a little bit about the heparin shortage. And so I think we should say I just got off clinical service. I'm a cardiologist just 6 days ago, so I've sort of been redosing, remembering myself with bivalve dosing. So just why has this heparin shortage happened?
Yeah, so I think to frame this correctly, we have to remind folks that heparin is primarily sourced from the intestinal mucosa of pigs.
Interesting.
And unfortunately, there's been an African swine flu that has affected China over the last 6 to 12 months. And it also turns out that China is responsible for about 80% of the world's primary heparin source material.
Wow.
So what that's caused is a bit of concern on hospitals across not just the United States, but Europe. And there's been a bit of a grab, if you will, of folks trying to stock up on heparin.
Oh, I see, because everyone wants it.
Everybody's looking for it. And then when you compound that by the fact that there's been a couple manufacturing problems with some manufacturers where they have to throw out entire lots of heparin, and that's a typical thing that happens. But when you then superimpose that on the current swine fever, you have a pretty acute shortage.
Interesting. And so what are we doing at Mass General about this?
Yeah, so I think the first step obviously is to really make sure that our supply chain team is working tirelessly to address this. They're looking at both primary and secondary distributors. They're going even so far as to directly call manufacturers to see if we can procure heparin. So they've been working, I think, around the clock to make sure, and this has been happening for probably the last 6 to 12 months, to ensure that our supply here is adequate. In addition to that, we have initiated the Hospital Incident Command System, which is our disaster response for heparin. And what that has done is brought together both a multidisciplinary group across service lines to look at things like conservation strategies, reducing waste of heparin, also looking at alternatives to heparin, whether it's for prophylactic uses or for treatment uses.
Interesting.
That group has really done a Herculean amount of work as it relates to resources, and I would refer clinicians to the HICS website on Apollo that has the most up-to-date information on alternatives and conservation strategies. And then the last part that the HICS group is doing is really trying to monitor this situation over time to make sure that we're doing what we need to do to ensure heparin is available for our sickest patients.
Great. Well, thank you so much for all this work, which has been so critical for us and for our patients. So great to talk to you.
Thanks. You.